And welcome back to Root Cause Radio. Today, I am over the moon excited for this podcast, and it is to be about Mast Cell Activation Syndrome, MCAS. I know some of you guys have not heard about it. Some of you guys have. Anya, are you ready? I'm so ready.
I'm so ready. And I'm sure you've been seeing this too. It's really, we could say, risen in popularity lately. Who knows if it's just that it's now more commonly diagnosed and more well understood, or if there are other factors that are driving it to be occurring more often. But it used to be very rare that I would have clients coming to me even aware of MCAS, and now it's like one out of every, I'd say, 10 new clients I have has had an MCAS diagnosis or is currently dealing with MCAS. And there are now more studies showing this prevalency increasing. And a recent study found it's in almost 20% of the general population. So this is no longer this sort of niche diagnosis or condition. It's actually pretty common now.
Yeah, no, I completely agree. And you guys, we're gonna go over what are triggers, what are root causes. Typically, there's more than one. I do want to let you guys know because I like my clients to know, and my people that come to me and people that listen to this podcast, what I deal with. For me, I have definitely had mast cell. I'm not saying I have mast cell activation syndrome, but I definitely do get and have had mast cell activation or mast cell flares. For example, like with mold, I became really sensitive to histamine, started noticing mast cell issues, and we'll talk about those symptoms. And for me too, like coming off of my honeymoon, I had to take antibiotics for this crazy mouth infection I got from eating a tortilla chip. Don't ask me why, but it just stabbed me and I had this massive mouth infection. But it sent me into a terrible mast cell flare, which is when I say like mast cell activation syndrome is different than histamine, it's completely different. So we're going to talk about that. But I need you guys to understand first and foremost, and I'm talking with my hands now, I'm being aggressive with it because there's a complete difference between I have histamine intolerance, we've talked about in a previous podcast, and I have mast cell activation syndrome. So today, we're not talking about I just have histamine intolerance. We're going to talk about the difference, but we are specifically talking about mast cell activation syndrome. So what are mast cells, right? Mast cells are a key part of our immune system. They basically act as first responders when the body detects invaders like bacteria, parasites, allergens, food chemicals. It could be really anything. And I think of them like Pac-Man in the body. I'm a child, so that's just the way I think. And to engulf and destroy the invaders. And these quote unquote Pac-Man also release chemical messengers like histamine and cytokines and leukotrienes, all these different types of chemicals. And this helps us to fight off threats. Now, that's a good thing, right? We want our body to say, oh my gosh, fire alarm, there's something going on. But when mast cells become overactive or hypersensitive, or if on top of that, you don't have the ability to degrade the histamine or fight the inflammatory chemical messengers, that's when you go into hyperdrive. You have too much that's being released, and that's when we develop mast cell activation syndrome. So mast cells are basically all over the body, whether that's the skin, the gut, the brain, the lungs, everywhere. We're going to talk about specific key points and symptoms that go with that. But there is a huge difference between mast cell activation syndrome, so MCAS, which can be also connected to SIRS, chronic inflammatory response syndrome. We're not diving into that. Those are two different things, but they are entirely connected. So, Anya, let's discuss the difference between MCAS and histamine intolerance.
Yeah. So, if you let me just say we have a great episode all about histamine intolerance and sensitivity. So I definitely recommend almost maybe starting with that first if you're really interested in understanding this conversation, because this is kind of like the first kind of stepping stone to MCAS usually is this sort of histamine overload in picture. So histamine intolerance, simply put, is your body struggles to break down histamines. And it could be that you are not producing adequate enzymes to do so. It could be that you have an overload of production. So it's usually a combination of both, honestly. Histamine intolerance, it could suck and it could definitely affect multiple systems in your body. We definitely see a lot of those classic allergy like symptoms, runny nose, hives, but can be brain fog and can be GI issues. It can be headaches. It really can vary. MCAS, however, is that, these overactive and hypersensitive mast cells. And remember, mast cells, they produce mediators including histamines, also other things like cytokines. And, the symptoms of that are much broader because, again, mast cells are found in various parts throughout our body, various different organ systems. So it affects different organ systems. And these symptoms are usually more debilitating, more severe. And often this is something that, is to a point where we need medical intervention. We need to incorporate pharmaceuticals at some point. So this isn't always something that we can just only use diet and lifestyle to resolve. We usually need to bring in some big guns to bring it down because it can be so extreme for people.
Yeah. The way I think about it, and it's way more complex than this, but I think of a histamine intolerance like we have an issue with breaking down that histamine, or there's too much histamine in that histamine bucket. Therefore, we're slightly intolerant to that. So typically, like reducing your histamine in your diet and giving a little bit of gentle histamine support. Like in our histamine podcast, we talked about DAO, stinging nettle, quercetin, things like that. It can be helpful. Whereas mast cell activation syndrome, we have actual overactive mast cells releasing these chemical mediators. And typically, the low histamine diet is not enough. We also have the cardiovascular issue, the digestive issue. So let's dive into these specific symptoms in regards to mast cell activation syndrome, and then talk about the diagnostic criteria. I think, the symptoms of MCAS, there's so many. I walk through these with my clients all the time. So you guys get ready. So we've got skin, flushing, hives, rashes, swelling, itching or raised welts. There can be these weird stretch mark like lines as well that look like you scratched yourself a ton. So skin issues can be big. I'm just going to, as we go through these, I'm going to also throw in my personal ones because I feel like that kind of helps people. So for me, it becomes flushing as well as redness, especially on my face and over my chest coming out of the shower. Then we have gut. So this is very annoying because it can also look like just gut related, parasites or candida or SIBO, but bloating, nausea, diarrhea, reflux, or abdominal pain. Now, for me and what I see with my clients is it is random nausea that gets exacerbated by stress or where you are in your cycle. We previously talked about period flu. Typically, period flu with the nausea and the gut and all the other symptoms can be a big mast cell activation syndrome type of sign. We've got the heart and blood pressure symptoms. These are the ones that are the scariest. I've dealt with this before. The rapid heart rate, the low blood pressure, the dizziness upon standing. A lot of people with POTS, postural orthostatic hypotension, do also have MCAS. And this is the scariest symptom to me. It feels like, oh my God, I'm going to faint out of nowhere. It feels like sometimes my blood sugar is low when in fact your blood sugar is not low whatsoever. It's just like, oh my gosh, I don't feel good. What's going on? And that can be a blood pressure type of issue. Sometimes it's, serum osmolality. Sometimes it's also triggered by electrolyte imbalances. But definitely that's a key indicator. We've got the lungs, so shortness of breath, wheezing, throat tightness. We also have nasal congestion or runny nose or sinus-based issues. If you have any of the throat tightness, the wheezing, the shortness of breath, typically a lot of doctors first go to asthma, but that can also be correlated to the mast cell drive in the lungs in itself. And that's a very scary thing for somebody to have to deal with. And that gets typically exacerbated by foods they think they are allergic to, when in fact, it's not actually the fact that they're allergic to that food. Is the fact that the mast cells are just overactive. Then we have the neurological, the headaches, the brain fog, the anxiety, the mood swings, the depression. I know for me, when my mast cells get kind of active, I get super anxious. Sometimes it's brain fog, but typically it's anxiousness or kind of like, I wouldn't say depression, but it's like really low motivation. Like I just don't feel like myself. I don't want to go to the gym. I don't want to enjoy the things that I love. And it's very annoying. And then we also have the other random things that can happen, whether that's, really bad menstrual cramps. A lot of women that have MCAS do have more painful, heavier periods and cramping prior to their periods, really bad bloating, or quote unquote, like Shark Week. PMS is pretty bad. There's the chronic fatigue aspect of it because your nervous system just gets shot with everything, the mast cells, the inflammatory chemicals. Your body can't tolerate that. So a lot of people deal with chronic fatigue. For me, my chronic fatigue is the absolute worst in these layers. And then there's joint pain because absolutely with inflammation, your body is going to cause any shape or form of pain, whether that's muscular pain or joint pain. And one more thing, and then we'll dive into the diagnostic criteria, is, and I just see this connection with POTS and MCAS, is what I call coat hanger syndrome. So super tightness around kind of like the top of your traps and your neck, kind of like where you would hang a coat. You would, if you had your body and you would hang up your body like in your actual closet, that would be weird, but that's the way I think of it. And there's a lot of that pain and tightness right there. I think that's also neurological, but I just did a lot of talking. So Anya, any thoughts on these? Because there's a lot with these symptoms.
Yeah. And listen, there's even more. So if you're listening to
Yeah,
this
there
and
are.
if you're listening to this and you're a human being, you're probably like, oh, I've had that. I have this. I have
I
this,
have
right? Because
MCAS.
yeah, because like we all have symptoms in various systems in our body here and there. Like no one lives their life 100% symptom free, even like the healthiest of the healthiest, right? So how do you know like if this is MCAS or if this is something else? So first of all, there's no perfectly standardized diagnosis criteria. In some ways, it's a diagnosis of exclusion, but there are also kind of ways that we can rule it in a little bit better. So, of course, one of the main criteria is that you're having chronic symptoms that are affecting at least two organ systems in the body, right? Like you're not just having GI issues, you're not just having skin issues, you're not just having these heart issues, you're having at least two of those happening. Usually with MCAS, we see more than two different systems affected at once. Secondly, you have a positive response to being put on medications that are mast cell blockers. So sometimes just like trialing some of these medications, like H1, H2 blockers, we'll get into that a little bit later. If you respond well to those and your symptoms really subside with those, that could be a sign that you have MCAS, or at least that mast cells are playing a major role in your health issues. And there are other, I think it's called mastocystitis, which also can kind of look like this, but that can be diagnosed. Usually it's a bone marrow test for that. That's a more serious condition, but
Yeah.
that's kind of a separate conversation. I regress. Anyway, the third sort of main diagnostic criteria is, and this one's very hard to do because you have to test during a flare, and it's the elevation of those mediator markers. So tryptase and histamine are the most commonly tested mediator markers. Again, it's very hard to do this right.
Right.
These are very sensitive markers. They degrade very quickly, and so it has to be like perfectly tested right when you're in a flare. It has to like run right away. And if those are elevated, that also can kind of help confirm that muscle display picture. There are other less common but really valuable testing markers that are sometimes used, different forms of prostaglandins, different forms of like leukotrienes, I think they're called, but I honestly rarely see them. Sometimes they're being tested. Usually it's really the having chronic symptoms across two systems and positive response to mast cell blocking medications. Those are the two most common ones. So let's say that, you fit this criteria and, you are diagnosed or you can conclude that you do have MCAS. Now, there are sort of two sort of discussions here. First is like the common root causes of MCAS, and the other is common triggers. And the
Right.
triggers aren't like necessarily the root causes. They are just like the things that can actually like initiate that flare of symptoms, right? So, the triggers for a lot of people, really anything that throws the body off of balance, anything that's changing your system or causing your nervous system to have to kind of shift or adapt. So, of course, any sort of stress, that could be not sleeping well, that could be work stress, personal stress, that could be being like in a really busy, stressful place, like an airport, for example, or a very loud party where your senses are just overloaded. I see that trigger a lot of people. Any sort of like environmental changes, so weather changes, temperature changes, seasonal changes as well can be big issues for people. Any sort of like environmental irritants, fragrances are huge. I don't know if you've ever been like the back of an Uber or Tesla and like you
Oh
have like
Lord. Why do you have
fragrances
to throw
going.
the Tesla out there?
I'm sorry,
Just
because
throw
they
me
are
under the
so
bus.
sensitive people. I know you're a Tesla driver, but a lot of sensitive people hate Tesla. I thought I was the only one for years sitting in the back of it. I'd always want to like absolutely throw up.
It's because
Now
the
I
back
know
of the Tesla you never want to be in. It's not
it's
a
the
fun
worst.
ride.
It's the
Yeah, the
worst. It's
front
the
ride
worst.
is good. The back ride is not. I will admit.
There we go. But yeah, environmental irritants for sure. And like then of course there's more extreme cases like, mold and whatnot. Sometimes also like a physical injury, or exerting yourself too hard in a workout can be a trigger. Eating a lot of high histamine foods for some people can be a trigger for sure. And then also like being on medications, like for you, the antibiotics can be a common trigger for some people. You know, even some other like over-the-counter medications, like other NSAIDs as well, can trigger a MCAS flare.
Yeah, exactly. And, when we're thinking quote unquote root causes, sometimes there's not necessarily like one root cause, there's multiple, or
Almost
there are,
always.
yeah, and then, or there can be just multiple triggers that ultimately the body just can't handle all that inflammation and the nervous system becomes dysregulated, which we'll talk about. And that can start the development of histamine issues, which then can result, if those aren't fixed or addressed, into a mast cell activation syndrome issue. So for the most part, clients that I work with, and I want to hear, your opinion too. If I think MCAS root causes, like the top ones I would say are typically, and there's like, they're intertwined together, but there's some shape or form of bacterial or viral issue, whether that was induced by COVID, even the COVID vaccine, or something like Lyme or cat scratch fever. And then there are things like GI issues, whether that's SIBO playing a role, candida, parasites. I see a lot of kind of like genetic factors involved with this. So maybe something like HNMT or the MAO, or specifically the DAO gene. So an issue with degrading that histamine can increase potentially your chance of developing mast cell activation syndrome, because you already have a genetic predisposition to not being able to filter that or degrade that histamine as well. There's also nutrient deficiencies, but the biggest thing that I see is stress and trauma. Because yes, and it's so tough, because whenever somebody has MCAS, like the last thing you want to start with when you see the symptoms is like, what trauma have you gone through? Like, we don't want to dive into that, right? That's like something we don't want to talk about. But unfortunately, the body keeps the score. I've never actually read that book. That is a book that's incredible to talk about it. I haven't read it because apparently it's more so about like PTSD from people in the army or the Navy or whatever. But regardless, the body keeps the score. So what I do see in practice is a lot of people that have gone through trauma, and that can be emotional, that could be physical, that can be spiritual. It does not matter. People that have gone through trauma, they start developing a dysregulated immune system and a dysregulated nervous system. Therefore, their body is already predisposed to going into fight or flight mode, sympathetic mode, which causes mast cell mediators and inflammatory chemicals, and also cortisol, to be more released at a faster rate. So these people start becoming very hypersensitive. There's a lot of people call it, there's so many things that people are, that are trending nowadays. There's quote unquote overactive immune disorder. There's nothing to prove that exists. And then there's the highly sensitive individual, which a lot of people are saying, oh, that's me. Well, that's because everybody wants to be a special chicken. So not everybody is a highly sensitive individual. But trauma definitely is a huge factor in regards to developing MCAS, in my personal opinion. What about you, Anya? What do you see as the biggest root causes or triggers?
I couldn't agree more, honestly. I mean, I think there's always some level of nervous system dysregulation tied into this, right? It doesn't have to be trauma, or it could just be that like you just have really poor stress coping mechanisms, and that might be your fault. It could also be genetic as well, just like that other sort of like predisposition with like the HNMT and the DAO genetics. There could be an issue with COMT or MTHFR, and all of that can also kind of contribute to that nervous system for stress management skills, right? So I think the key takeaway as it pertains to addressing the root cause is that as much as we love addressing the root cause, you cannot jump into this when you're in an MCAS flare. The nervous system component, you can and you should and you need to work on that from day one. And you probably
100%.
might have to work on that for the rest of your life. It's an ongoing process. But everything else, like, you cannot go into a detox or kill phase when you're having a flare. Your body just can't handle it. The first step is you need to quell that fire. You need to bring yourself into a stronger, more stable state. And then once you're stabilized, you can work with someone who is well-versed in MCAS and go very, very slowly and gently, working backwards with your detox pathways as well, while working on that sort of thing. So that's the key component. Like if you're feeling like you might have MCAS and you go see a practitioner and they're like, okay, we got to put you on like, all these IVs, all these antimicrobials, all these binders, do sauna, do this, do that. I would really caution you. And you start to feel worse during that. That's not necessarily a sign that it's working. That could be a sign that's too much for your body. So
before I forget, how in the hell did I forget about and not say mold? I think it's because my body is in my mind are trying to not talk about mold anymore.
I would put that
Literally
I
trying to put it in the back, but mold
I
would be
would
at
put
the
that
top
in
of
the
everything.
toxic. I put that in the
Literally.
toxic bucket, right? That's a toxicity that I put there. I put mold, metals, or other sort of
Yeah.
infections like Lyme or whatever. But yeah, mold I think is almost always part of the picture of MCAS, honestly.
You love how my brain's trying to forget about it.
I mean, that's the only way we survive. We have to do
right.
that.
Right.
Yeah.
So just you guys, there can be underlying root causes and then there could be triggers. So say one day you're exposed to mold or you've been living in mold. Sometimes you don't develop a histamine issue or mast cell activation syndrome right away. It could be, hey, I then after have that mold, I had to take an antibiotic for some shape or form of UTI that I got. Or maybe it was I unfortunately had food poisoning and then it's the mold and the food poisoning causing the development of the overburdens in the immune system, plus the development of the mast cell degranulation. And degranulation, just so you guys know, is beautiful in my head. I want you to picture a flower that's just going poop and all the little pollen is just going everywhere. That's what happens as mast cells degranulate in your body. You're welcome. You can picture that the rest of your life. But that's the way I think about it, and that typically happens. So yeah, let's talk about the interventions. So we briefly discussed that. And my approach first is how does somebody respond using these natural antihistamines? And how does somebody respond with reducing histamine in the diet first? We talked about the diet with histamine. We're not going to go over, back over that. But, typically things to consider when we're starting with mast cell support, I would say would be doing things like DAO. So DAO helps to degrade histamine. So you're giving what you might be low in or just giving you some gentle support. Now, DAO products, because a lot of people, they try them and they're like, that didn't do anything. That is not going to do anything if the nervous system is still in hyper alert and there's more than just histamine involved, right? With MCAS, we have the leukotrienes, we have the inflammatory chemicals like ILK6, or IL6, sorry. I think ILK because there's killer cells involved too. But DAO typically is the first route of approach. I like to also go in there with things like quercetin, nettle, vitamin C, which helps to degrade histamine. There's 5 billion other things that we could do, like throwing in probiotics or staying away from probiotics, throwing in probiotics that are antihistamine. So I love the Seeking Health one, or staying away from probiotics that cause histamine to flare up. And then in regards to supplements as well, I really like Perilla. That's another one that's fantastic. Any others that you like if we're talking about just supplementation?
I mean, the Seeking Health, their entire histamine line, I think is great. I use them a lot with my clients with histamine or MCAS. I love their probiotic because probiotics for histamine people can actually make things a lot worse a lot of the time. This one specifically has histamine degrading probiotic strains and none that can be histamine producers. So it's a really nice one to take. Their histamine nutrients is great. It has DAO and some other histamine sort of breakdown cofactors. And their histamine X is nice too. It has stinging nettle. Stinging nettle in general is one of my favorite herbs for histamine issues. You could have it as a tea, you could have it as a capsule. So that's another great one too. But yeah, usually like supplements, diet, easy first step. But
Can I throw one more in? Can I throw one more in?
Yeah.
Okay. There's a product, and I don't have a code for you guys at all whatsoever, but I have seen this be a starting game changer since I found out about it. It's by Healthy Gut Hollow Immune. It basically has beta glucans in there as well as a postbiotic, and that one is fantastic for histamine reactions, specifically the people that deal with ongoing GI upsets and the quote unquote like food sensitivity secondary to histamine. And sometimes those food sensitivities are not just histamine. It can also be sulfur or sulfites or oxalates. And I have seen this product be fantastic to help kind of like calm down the inflammatory response. So just want to throw that out there. And one more thing I found out, just me giving as much information as possible in my brain. So sorry, you guys. It's like everywhere. But though I love quercetin, with MCAS, we also have a hyperactive nervous system. So we also have to think about MTHFR and COMT, how we methylate and how we degrade our neurotransmitters. So, for example, quercetin slows down COMT. COMT is responsible for breaking down cortisol, epinephrine, norepinephrine, and estrogen. Love quercetin because it's fantastic for helping with histamine. But if you have a slow compt like me, and then you add in quercetin, which further slows it down, you have even more estrogen, norepinephrine, epinephrine, cortisol linear in your body longer. It makes me feel like I am a cat that wants to attack people and I cannot sleep. So some of these things we've got to be very careful, kind of know our genetics. Trial and error is key. I just wanted to throw that out because if that has ever happened to anybody, or for example, a lot of people get thrown methyl B vitamins to support them just in case with histamine, because we need our B vitamins to degrade our histamine too. If you throw in methyl B vitamins and you have a slow compt, or you have some shape or form of toxic burden and overload, you're going to also feel like an anxious, stressed out pigeon. Okay.
Yeah. B vitamins, I'd definitely be careful with
Yes.
any sort of histamine MCAS issues.
I'm done.
Yeah. No, that was important. I mean, again, with all this stuff, there's so much nuance and things that we could add. Like we could talk about this forever. But I will say, just, if you're having like MCAS and it's pretty severe, right? Like, and scary, like, especially like with the heart issues, I find like those cardiac issues or like the severe nervous system issues. Sometimes I just say like, let's jump to trialing some over-the-counter medications,
Yeah.
right? I mean, I think now there's some people in the space that are doing a really good job, I think, destigmatizing the use of pharmaceuticals, but it's just because we are functional medicine practitioners, we love using natural remedies. We are not against using pharmaceuticals, and MCAS is scary and debilitating, and we need to get you feeling better ASAP. So, really using a combination of H1 and H2 antihistamines, and you can get those over the counter. If you just give that a trial for a few weeks or so. See how you feel. If you are feeling a lot better on it, it's fine to kind of stay on it while you work on adjusting your diet, supplements, getting a nervous system, getting everything kind of like stabilized. And then you can work on weaning off of it. So H1 blockers, some common ones we see are like Claritin, Zyrtec, Allegra, and H2 blockers. So they work on stomach cells. So you may think of these as things actually that you maybe have taken like for reflux or heartburn. Pepsid is a good example of one. You can use both of them in tandem, and it works really, really well for people. There are some other medications to consider for, a variety of other, again, like MCAS symptoms and issues. Cromolyn sodium is one that's used a lot. I personally don't use this myself, but, some functional medicine doctors who work with MCAS patients do. Aspirin also in some cases can be helpful with managing symptoms, but usually the H1, H2 on its own can be fine. And again, antihistamines, yeah, they get a bad rep. We don't want you to be on them forever, right? Chronic use of over-the-counter medications can lead to negative implications. Short-term use, fine. And in the end of the day, what we need to do is we want to get you so that you're able to live your life and enjoy your life. You don't get a prize for doing that without them being on any medications, right? So I honestly, I have no problem with utilizing these medications short term to get you to a better state. And then the other area that I would just, kind of want to touch on is just like your general lifestyle, right?
Do you mind if I go back to the medications real fast? I just throw in something. Yeah. So this is just me trying to throw everything that I can here at the kitchen sink. Anya's like, oh no. So with the H1, we've got H1, think the allergies. So those typically are going to be more so helping with like the itching, the flushing, the brain fog, the fatigue. Keep in mind, some people respond better to different allergy medications. For example, I do well with Zyrtec. I don't do well with Claritin or Allegra. And then those can suppress your stomach acid, but short term, I mean, we don't want to worry about that when we can help with the mast cells. H2, we want to think more of the Pepsid, the famotidine, things like that. So we want to necessarily do just a PPI. We want to make sure that it's an H2 blocker. So the H1, the H2 are blockers. They are specifically blocking histamine. There's different types of histamine receptors, H1, H2, H3, H4 in different parts of our body. So we want to target H1, that's overall systemic. H2, more so for the gut in particular. Then we have the mast cell stabilizers. Those do not block histamine. Those just help potentially to stabilize mast cells. So that's when Anya was talking about the kind of like cromolyn, there's ketofen, the aspirin, those fall into those. And then we also have things that help support leukotrienes as well, which I believe is kind of like montelukast, something I would never throw in unless you need to, because it has a lot of depressive side effects. But these things work in different mechanisms. So typically you've got to try multiple. I want to throw out that I have personally seen that H1 alone did not do anything. I personally had to go in there with an extra H1. And sometimes you need one H1 or two H1, or you need one H1 and an H2, or adding the mast cell stabilizer. So it depends per person. Of course, if you worked with us, we'd be able to walk you through all of that. But okay, I was very rude. Anya, you were talking about toxic load, right?
No, yeah. No, I mean, this is important, right? And again, so much nuance to all of this, which is why it's so hard to break this down to like a short podcast.
Yeah.
So, okay, listen, while you're doing all of this, the lifestyle stuff, you definitely need to work on, right? So we talked about nervous system dysregulation and how that plays a huge role. There's a lot of great resources out there. There's Primal Trust. There's a Gupta program. There's Irene Lyons program. There's Nicole Sachs. There's a million other things. So
did you say Nimble Socks?
Nicole Sachs. She
stop. Sorry. Okay.
Yeah.
Okay.
And, now whenever I say her name, I'm going to think of that. Then, also reducing your toxic load, right? And so that could be literally like physical products, right? Like changing your home care, your household cleaning products. It could be looking at your home as well for things like mold or other toxicities or pollutants in the air. It could be even things like, reassessing your personal life and your professional life and how that's maybe like negatively impacting your nervous system too, right? So we could talk about this part forever, but I just say that this goes in tandem with everything that you're doing because again, MCAS, it's not usually just one root cause. It's not even usually just two root causes. It's usually an overload of a lot of things. And so you need to approach it from all different angles in order to truly heal.
I completely agree.
Yeah.
So typically if we're like looking at what are the first steps to help if you potentially have MCAS, right? Would be starting with your nervous system. The hardest thing to do. It's the most annoying thing. It's the one that I do not like to personally even touch because it's uncomfortable, but we grow and we actually heal in the uncomfortable. Typically, if there's something we don't want to do, this is me ranting, it's because we need to do it, right? I don't like split squats. They suck. I need to do them because that's what my body responds well to in the gym. But yes, 100% reducing the toxic load. You cannot heal MCAS if you're living in mold. Okay. Nervous system regulation, extremely important. I would say past that, 100%, the supplements, the mast cell stabilizers or histamine support has to go in there. We have to make sure you don't have anything in your gut exacerbating, increasing the histamine load, or having anything like a nutrient deficiency, not allowing you to further degrade histamine. Because if you're missing a key nutrient to degrade histamine, then you're not going to be able to feel your very best. And then we want to go in there then use supplements, medications as needed. The key thing is figuring out like, why is my body in the mast cells, why are they hyperactive? Why are they responding inappropriately? You have to stabilize first. Then you can work on the deep internal causes like detoxing from mold, like going in there and killing off whether that's Lyme or Bartonella, whatever it is that you're dealing with. You have to make sure you stabilize first, or you're going to send your body into a further worsened flare.
Absolutely.
So this was good. Any key points for you, Anya, with MCAS that you want to leave these folks with?
I think again that like I'm glad it's being talked about more, it's being diagnosed more, but it could look like a lot of other things. A lot of things can look like it too. So it's really sometimes satisfying to attach to a diagnosis, but just because you're listening to this and you're like, I have those symptoms, I wouldn't immediately jump to MCAS. I would work with someone who's well versed in MCAS, but isn't seeing everything through MCAS goggles, because it could be a lot of other things too, right? Yeah. And then, secondly, that again, like if it is MCAS, be cautious when you're working on this to not jump into all the fancy, sexy functional medicine, detox, killing stuff. Get that fire quelled down, get your body feeling strong, resilient, and then slowly work on that.
Yeah. I'm going to throw out two things. One is I see a lot of MCAS with also EDS and POTS. So POTS, already talked about that, postural orthostatic tachycardia syndrome. It's basically dizziness upon standing, rapid heart rate upon standing. There's different variations to POTS. Feel free to Google them. That deserves its own podcast, but there's a huge connection with that because mast cells can worsen POTS or cause actually POTS. Then we have EDS, Ehlers-Danlos syndrome, may not have correctly pronounce that, but I do see that's a connective tissue disorder. You are born with that, and that does influence and potentially increase your chances of having POTS and MCAS. So there is a trifecta with that. Don't fall into the weeds of I have all three, please. That brings me to point number 2. A lot of people with MCAS, they are type A people. We deal with a lot of crap. Like I said, these are the people that have gone through trauma. That being said, I fall into that boat. We can many times look for multiple root causes, right? Oh, it's mold. Oh, it's Lyme. Oh, it's gut. Oh, it's, something else I need to fix. That can hold you back from healing if you're always chasing what is the root cause or what are the root causes. So just know you can heal without definitively finding out everything at the same time. Okay. I see what holds people back from MCAS is not doing their nervous system work and continuously chasing symptoms when you should be, yes, symptoms matter, but you should be chasing what helps you love and enjoy your life as much as possible too. Okay. So just throwing that out. I'm turning into a mother now that I have 2 dogs. I'm turning into a mother.
All right. Well, thank you guys so much for listening. And if you have any other questions on MCAS, if you're looking for support with MCAS, Lacey and I are here for you. We get it. We've been through it and we help people with this every single day.
Yeah, exactly, you guys. So make sure you go. We'll have kind of like a description of what was involved in this podcast in the notes below. You can go there to always contact us. Definitely holla at us if you want any specific topics. We're going to try and keep pumping these out so you guys feel as supported, but also as educated as possible. If you can, make sure to rate this podcast. That will also help it to grow. And thank you guys so much for listening.
Thanks.
The recording has stopped.
All right, cool.